Hi everyone, my name's Sian, and today I'll be discussing our team's research on evaluating the effectiveness of a memory skills intervention for brain tumour survivors. It's clear that there are significant risk factors for decreased memory and thinking skills following a brain tumour diagnosis. We know that these effects can be global, impacting multiple thinking skills domains, and we also know that often memory is impacted. And although these effects can often be expected, are they also just accepted with no management options available to brain tumour survivors? Our team asked exactly that question, among others, early last year when we conducted focus groups with brain cancer care coordinators throughout Australia. And what we found was that the most likely management option was for OTs or the care coordinators themselves to provide strategies to their patients when cognitive issues were raised to them. We also found that neuropsychology referrals were very unlikely outside of the context of a decision-making capacity assessment, so really only those with severe cognitive impairment. So is there any other options available for brain tumour survivors? We believe there is, in the form of the memory management program LATCH. LATCH is a 6-week memory skills group intervention. It was originally developed more than 10 years ago and designed to assist older adults in managing the age-related changes that occur to memory. So it's a very well-established intervention in the older adult space. The intervention sessions are delivered by 2 LATCH-trained neuropsychologists, and the content is manualized. So it takes a CBT approach, providing education on memory and delivering targeted strategies to manage everyday memory difficulties. There is also evidence that LATCH might be effective for brain cancer as well. In 2019, our research team conducted a pilot study in collaboration with the Olivia Newton-John Centre to determine whether LATCH was effective for brain cancer survivors specifically. And the results were really promising. So the participants improved on their memory goals. They were reporting increased memory ability and memory satisfaction after the intervention. And in follow-up interviews we conducted in 2021, they were also reporting that they really felt like they got a lot out of LATCH. However, recruitment was a significant challenge, and we're attributing that to the fact that LATCH was a face-to-face intervention at that time. So ultimately, only 5 brain cancer patients with brain cancer were able to be recruited, plus an additional 5 patients with other cancer diagnoses. And so the plan was to recruit more brain cancer survivors the following year to build up that evidence base that LATCH is effective for this group. However, of course, the following year was 2020. And the lockdowns of 2020, which meant that all LATCH research for brain cancer or brain tumour had to be put on hold at that time. One benefit of the lockdowns of 2020, though, was because LATCH was already a well-established intervention for older adults, a separate research group decided to determine whether it was just as effective over Zoom, and they found that it was. And so that brings us to LATCH today. So currently we're running a randomized controlled trial to determine the effectiveness of LATCH following brain tumour or brain cancer diagnosis. The sessions will be run over Zoom to prevent those previous participation barriers that we saw. And we're aiming to recruit up to 100 participants. So we have a very broad inclusion criteria where any tumour type is within our inclusion criteria. Also, provided that it wasn't a pediatric brain tumour. Also, we're recruiting participants with any tumour grade, any time post-diagnosis. It could be 20 years, it could be 20 months, 20 weeks, as long as it's a minimum of 4 weeks post-surgery and 4 weeks post-radiation therapy. And we're also recruiting anyone above the age of 18. And currently we're right in the thick of recruitment. So at the present time, we've recruited 40 participants aged in range between 30 and 70. We've recruited a range of tumour types, so all varied diagnoses from gliomas to glioblastomas and multiple other tumour types that I couldn't pronounce here today. While we haven't conducted any formal analyses yet, the results are looking really good on our outcome measures, and we're getting great feedback from participants in the post interviews. Currently, we've completed the intervention sessions for 2 intervention and waitlist group pairings, and we have 3 more groups to fill this year. So if you or a loved one would like to learn more about participating, if you would like to learn more about how to refer a patient or a client to Latch, please reach out to us. We would absolutely love to hear from you and chat about participation or referrals. Thank you so much for listening.